Listen carefully. If you are over the age of 50 or 55 and you are taking vitamin B12 right now, stop what you are doing and pay very close attention, because there is a very high chance that the way you are taking it is doing almost nothing for your body. I know that sounds insane, but stay with me, because what I am about to share with you right now could genuinely transform how you feel on a daily basis. Your energy levels, your mental clarity, your mood, even the tingling and numbness some of you have been dealing with in your hands and feet for months, sometimes longer than you would like to admit. And the frustrating part? Many of you are already spending hundreds of dollars every month on B12 supplements. You are already putting in the effort. You are already trying. But the problem is not that you are not taking B12. It is how you are taking it, when you are taking it, and in many cases, the specific form of B12 you have been sold is one your body can barely even process after a certain age. Nobody is telling you this. Your doctor probably handed you a recommendation, maybe pointed you toward the supplement aisle, and sent you on your way. The bottle at the pharmacy looked perfectly fine. The label clearly said vitamin B12. You thought you were covered, and yet here you are, still exhausted, still mentally foggy, still wondering why this vitamin that everyone keeps talking about does not seem to be making even the slightest difference in how you feel. I am Dr. Robert Casey, and I have been practicing medicine for a very long time. I have worked with thousands of patients across many years, and I can tell you from genuine clinical experience that vitamin B12 and vitamin D deficiency in seniors is one of the most consistently underdiagnosed and mismanaged issues I come across in my practice. So today, I am going to walk you through absolutely everything. Why the most common approach to B12 supplementation is failing you on a fundamental level, what you should actually be taking instead, how to time it properly for maximum absorption, which foods genuinely help, and the warning signs that your B12 is dangerously low even when your blood work comes back and says everything looks perfectly fine. And please stay until the end, because the final section on blood testing may honestly be the most important thing you hear all year when it comes to your health. Mistake number 1. The most common, taking the wrong form of B12. Walk into any pharmacy or grocery store, pick up a bottle of B12, flip it over, and take a careful look at the ingredients list. There is a very good chance that what you are holding is cyanocobalamin, the most common and cheapest form of B12 currently on the market. It is synthetic, manufactured in a laboratory, and it is the form that most doctors recommend simply because it is the most widely available and the most extensively studied over the decades. Now, cyanocobalamin is not going to harm you. I want to be completely clear about that. But here is the real issue that most people are never told. Cyanocobalamin is not a form of B12 your body can actually use directly. Your body first has to convert it, stripping off the cyanide molecule that is chemically attached to it, and then converting it into one of the two active forms that your cells can actually utilize, methylcobalamin and adenosylcobalamin. That entire conversion process demands energy, requires specific enzymes, and depends on a liver that is functioning at a reasonably efficient level. For a younger, healthier person, that conversion happens without much difficulty. But for a senior whose liver function may be gradually declining, whose enzyme production is naturally reduced, and whose overall metabolic efficiency has slowed down considerably over the years, that conversion process can be significantly impaired. So you swallow a pill every morning, your body struggles to convert it into something usable, and a large portion of that B12 is simply excreted right out of your body through your urine. You are quite literally flushing your money and your health straight down the drain without even realizing it. If this is already starting to make sense to you, go ahead and hit that like button and subscribe. There is a lot more on this channel that people over 55 genuinely need to hear. This is precisely why I recommend that the majority of my senior patients make the switch to methylcobalamin. Methylcobalamin is the active, ready-to-use form of B12. It requires absolutely no conversion inside your body. Your cells can begin using it immediately upon absorption. It is significantly more bioavailable, it crosses the blood-brain barrier far more effectively, and it supports a critically important biochemical process called methylation, which plays a central role in DNA repair, detoxification, neurotransmitter production, and long-term cardiovascular health. There is also adenosylcobalamin, the form of B12 that works primarily inside the mitochondria, which are the energy-producing powerhouses found inside every single one of your cells. Some of the best and most thoughtfully formulated B12 supplements on the market today now combine both methylcobalamin and adenosylcobalamin together to give you truly comprehensive coverage. If you can locate a supplement that contains both of these active forms together, you are already in a dramatically better position than the vast majority of seniors who are still taking plain cyanocobalamin every day without knowing the difference. Vitamin B12 is deeply involved in some of the most fundamental and essential processes that keep your body functioning properly day after day. It plays a very direct role in red blood cell production. When your body does not have adequate B12 available, it begins producing red blood cells that are abnormally large, oddly shaped, and completely unable to carry oxygen efficiently through your body. That oxygen deficit is one of the primary reasons you feel so profoundly exhausted all the time. It is not simply a matter of getting older. And here is something that most people never connect. This same deficiency also affects your brain in ways you would genuinely never expect. We will get to that in just a moment. Beyond red blood cells, B12 is absolutely essential for protecting your nervous system, specifically the myelin sheath, which is the protective coating that wraps around your nerve fibers and keeps them insulated. Think of it exactly like the rubber insulation wrapped around an electrical wire. When that insulation begins deteriorating and breaking down, signals simply do not travel through your nerves properly. That is when you begin experiencing tingling sensations in your fingers, numbness in your toes, unexplained balance issues, and in more serious cases, nerve damage that can ultimately become permanent. I want you to really hear that word clearly: permanent. If B12 deficiency is allowed to continue long enough without being properly addressed, the nerve damage it causes may not be reversible, even after you finally begin supplementing correctly. That is precisely why getting this right matters enormously, and why getting it right now rather than putting it off is so critically important. B12 is also absolutely vital for healthy brain function day to day. It is directly involved in the production of important neurotransmitters, including serotonin and dopamine, which regulate your mood, your motivation, and your overall sense of mental well-being. There is very well documented research clearly linking chronically low B12 levels to depression, anxiety, persistent memory problems, and accelerated cognitive decline. I had a 71-year-old retired engineer named Gerald come into my office about 2 years ago. He was convinced, completely and absolutely convinced, that he was in the early stages of dementia. His wife had come in with him. She was in tears. His grown son had already started researching assisted living options in their area. Gerald himself had stopped driving because he was so frightened of his own mental lapses. After a thorough and careful evaluation and appropriate B12 intervention tailored to his specific situation, his mental clarity began improving noticeably within just a few weeks. He called my office about 6 weeks later and told me he felt like himself again for the first time in over a year. Now, I am absolutely not saying that B12 is some kind of magical cure for Alzheimer's disease or dementia. That would be deeply irresponsible of me to suggest. But what I am saying with complete confidence is this: some of the cognitive symptoms that seniors experience and simply attribute to the normal process of getting older are actually being driven by a correctable nutritional deficiency. And that reality should give you genuine and meaningful hope. Here is where things get truly critical, and most doctors are simply not explaining this part clearly enough to their patients. The core issue comes down to absorption. When you eat food that contains B12, your stomach produces hydrochloric acid and an enzyme called pepsin. These two work together to separate the B12 molecule from the protein it is chemically bound to inside the food. Then your stomach produces something called intrinsic factor, a very specialized protein that binds to the freed B12 and carries it all the way down to the end of your small intestine, where it finally gets absorbed into your bloodstream and put to work. That is a beautifully designed and elegant system when it is working properly. The problem is that as you age, your stomach produces progressively less and less hydrochloric acid. This is a completely natural and unavoidable part of the aging process, and by the time you are in your 60s or 70s, your acid production may have dropped significantly from where it was in your younger years. Some research suggests that up to 30% of adults over the age of 50 have a condition called atrophic gastritis, where the stomach lining has thinned considerably and acid production is substantially reduced as a result. Without adequate stomach acid, you simply cannot liberate B12 from food the way your body needs to. It passes right through you without being properly absorbed. And if you are currently on any of these common medications, this next part could genuinely explain everything you have been experiencing. But it actually gets even worse than that. Many of you are simultaneously taking medications that further suppress your already struggling stomach acid production. If you are currently on a proton pump inhibitor, omeprazole, lansoprazole, or any of the similar acid-blocking medications commonly prescribed for heartburn or acid reflux, those drugs are specifically and deliberately designed to reduce stomach acid production. That is their entire purpose. And while they may successfully ease your reflux symptoms, they are simultaneously and significantly undermining your body's ability to absorb B12 from the food you eat. The exact same problem applies to H2 blockers like ranitidine or famotidine. And here is the one that catches so many people completely and utterly off guard: metformin. Drop a comment below if you are currently on metformin. I genuinely want to know how many of you were never warned about this connection. So now you have a clear picture of why you are at risk. Your aging body is already working harder to absorb B12 than it used to, and your medications may be quietly compounding that problem every single day. Now let us talk through the specific mistakes that most people are making. And we are going to work through them in order from the ones that affect the greatest number of people all the way down to the ones that are less commonly recognized but every bit as important. Mistake number 2, swallowing it as a regular tablet. The form of B12 is only one part of the equation. The delivery method matters every bit as much. And this is another critical area where the vast majority of people are getting it completely wrong without any idea that they are doing so. The overwhelming majority of B12 supplements on store shelves come as standard oral tablets that you simply swallow down with a glass of water. That pill travels down into your stomach and then has to survive the entire digestive process and make its way through your gut before even having the chance to be absorbed. But we just discussed at length how your aging stomach is not producing enough acid and how your intrinsic factor production may already be compromised and declining. So even if you have made the smart decision to take the right active form of B12, if you are swallowing it as a regular tablet, you are still placing your trust in a digestive system that may genuinely not be up to the task of absorbing it properly. This is where sublingual supplementation changes absolutely everything for seniors. And most people have genuinely never even heard of this option. This is precisely why sublingual B12 is such a remarkable game changer for older adults. Sublingual simply means under the tongue. These come as small dissolvable tablets or liquid drops that you place directly under your tongue and allow to dissolve slowly and completely. The B12 absorbs directly through the mucous membranes lining your mouth and passes straight into your bloodstream, completely and entirely bypassing the digestive system altogether. No stomach acid required, no intrinsic factor needed, no surviving the harsh and unpredictable environment of your gut. It moves directly into your circulation where your body can begin using it immediately and without any delay. The growing body of research on sublingual B12 is genuinely very encouraging, and for many seniors it has proven to be just as effective as B12 injections, which have traditionally been considered the absolute gold standard for people dealing with serious absorption difficulties. On the subject of injections, B12 shots, typically administered as intramuscular injections, have been used successfully for decades to treat B12 deficiency, particularly in patients diagnosed with pernicious anemia or other severe absorption conditions. They work reliably because they deliver B12 directly into muscle tissue without involving the digestive system in any way. If your doctor has specifically recommended B12 injections for your situation, that remains a completely legitimate and clinically effective treatment approach. However, injections are not always practical or convenient for everyone. They typically require regular office visits, can be uncomfortable and even painful over time, and are not always covered by insurance depending on your individual situation and coverage. For many seniors, high-dose sublingual methylcobalamin offers an excellent and far more convenient alternative that is much easier to realistically incorporate into everyday life. But, and this is genuinely important, if you have been specifically diagnosed with pernicious anemia, have undergone gastric surgery of any kind, or have a medical condition that severely impairs your body's absorption capabilities, please have a thorough conversation with your doctor before making any switch from injections to sublingual supplements on your own. There are real clinical situations where injections are truly and medically necessary, and I would never want anyone to discontinue a prescribed medical treatment based solely on watching a video without proper medical consultation and guidance. If you are watching this and are currently receiving B12 injections, drop a comment below and let me know how long you have been on them. I would genuinely love to hear from you. Mistake number 3, common taking the wrong dose. The recommended daily allowance of B12 for adults has been set at approximately 2.4 micrograms per day. That number was originally established based on the amount calculated to prevent deficiency in the general healthy adult population. But here is the critical thing that number does not even begin to account for: the significant absorption challenges and inefficiencies that come naturally and inevitably with the aging process. If your body is only absorbing a small fraction of what you are actually taking in each day, 2.4 micrograms is nowhere near sufficient to make a meaningful difference. For seniors with documented deficiency or known absorption concerns, many experienced functional medicine practitioners and geriatric specialists regularly recommend daily doses ranging from 1,000 to 5,000 micrograms per day of sublingual methylcobalamin, which is a dramatically higher amount. That may initially sound extreme and even alarming when compared to the official RDA figure. But B12 is a water-soluble vitamin that comes with an excellent and well-established safety profile. Your body efficiently excretes whatever it does not need directly through your urine. Genuine toxicity from oral B12 supplementation is essentially unheard of in the clinical literature. Of course, you should always work closely with your own healthcare provider to carefully determine the right dose for your specific individual situation and health history. But I want you to clearly understand that the standard recommendation is often genuinely and significantly insufficient for seniors. And that gap is one of the primary reasons so many of you are technically supplementing every single day while still not getting nearly enough active B12 where your body actually needs it. Make sure you stay until the very end of this video, because what I am about to share about blood testing may honestly be the single most important piece of information you hear today. Mistake number 4, taking it at the wrong time. When you take your B12 supplement also has a real and measurable effect on how well your body is actually able to absorb and utilize it. My consistent recommendation is to take sublingual B12 first thing in the morning on a completely empty stomach. This straightforward timing decision gives the supplement the absolute best opportunity to be absorbed efficiently through the oral mucosa without any interference or competition from food, beverages, or other supplements you may be taking. When you place it under your tongue, keep it positioned there patiently until it has fully and completely dissolved. Do not chew it. Do not swallow it prematurely. Simply let it sit undisturbed and allow the dense network of blood vessels running directly beneath your tongue to do their important work. The full dissolution process usually takes somewhere around 2 to 3 minutes. And I completely understand that can feel a little tedious when you are standing in your kitchen first thing in the morning, but those few minutes of patience could genuinely make the entire difference between properly absorbing your B12 and largely wasting it. You should also make a point of avoiding eating or drinking anything at all for at least 10 to 15 minutes after taking your sublingual B12. Give your body the time, the quiet, and the physiological space it needs to absorb everything properly before you introduce anything else into the picture. Mistake number 5, least commonly known, but critical, trusting your blood test blindly. This final mistake is the one that genuinely concerns me the most, and it is simultaneously the one that almost nobody in the mainstream medical conversation is openly talking about. Most physicians will routinely order a standard serum B12 blood test, which measures the total overall amount of B12 circulating in your bloodstream at the time of the draw. The typical laboratory reference range sits somewhere in the neighborhood of 200 to 900 picograms per milliliter. If your personal result comes back somewhere around 300 or 350, Your doctor will very likely tell you that your B12 level is completely normal, hand you your paperwork, and send you home reassured. But here is the fundamental and critically important problem with that approach. The standard serum B12 test measures both the active and the inactive forms of B12 present in your blood simultaneously. A very significant portion of what that test actually detects may be B12 that is tightly bound to carrier proteins and therefore completely and entirely unavailable for your cells to actually use for any biological purpose. The sobering reality is that you could have a serum B12 reading of 400, which looks perfectly fine on paper, and still be profoundly and functionally deficient at the cellular level where it truly matters. This is the precise reason why some people are told by their doctor that everything looks completely fine, and yet they still feel absolutely terrible every single day. The standard test is genuinely not telling you the whole story. This is exactly why I strongly and consistently recommend that my patients also specifically request testing for NTG methylmalonic acid and QK homocysteine alongside the standard serum B12 test. These are sensitive metabolic markers that become measurably elevated when your cells are not receiving adequate amounts of active, usable B12. Elevated methylmalonic acid in particular is considered a very strong and reliable indicator of genuine cellular B12 deficiency, completely regardless of what your serum B12 number happens to show. Homocysteine is another important marker that rises when both B12 and folate levels are running inadequate. Critically and very importantly, elevated homocysteine is also an independently established risk factor for serious cardiovascular disease, stroke, and accelerated cognitive decline over time. Having these additional markers tested alongside your standard B12 gives you a far more complete, accurate, and clinically meaningful picture of your true B12 status at the cellular level. If your doctor happens to be unfamiliar with ordering these specific tests, or seems reluctant to include them in your workup, please advocate firmly and clearly for yourself. You have every right to request comprehensive and thorough testing, especially when you are actively experiencing symptoms that are affecting your quality of life. Let me now walk you through the warning signs that may indicate your B12 levels are dangerously low. And if several of these apply to you personally, please consider sharing this video with someone you care about, because they may genuinely need to hear every word of this.